Springwoods Behavioral Health offers specialized treatment by a team of mental health professionals. This segment is sponsored by Springwoods Behavioral Health. We've got Jordan and Jacqueline here to share more. Welcome.
Yeah, thanks for being here.
Thank you for having us.
Sure.
Let's start with you, Jordan, talk about Springwoods Behavioral Health. Who do you serve there?
So we serve adolescents and adults. We have an 80-bed inpatient hospital, so we serve kids that are 12 to 17 on the adolescent unit, and we have 2 units of specialty for that. So we have a 20-bed adolescent unit and then an additional 20-bed adolescent girls unit where we serve those. And then for the adult population, we have 20 beds there, and we also have a 20-bed center for women.
Yeah.
So we serve patients that are in acute psychiatric crisis. So when your typical health care, such as an emergency room or a therapy clinic or an individual outpatient medical clinic has issues and they're seeing somebody with risk factors or suicidal issues, they get sent over to us, and we're the experts in that.
Yeah,
Okay.
for sure. Can you share more on the services once they come to you? What happens next?
So we give them a no-cost assessment. You don't need to have an appointment prior to getting that. So you can come through the facility at any time, 365, 24/7. So we're always staffed like a psychiatric emergency room for our people. And we make an assessment of that. And so we take a look and say, you know, what services are going to be identified. And so that can be inpatient if it's acute enough to where they're a high risk factor, immediate danger to themselves or others, and they're going to be put on our inpatient unit. And it's typically anywhere from about 7 to 10 day stay based on how well they're doing. We also have other levels of care, partial hospitalization, for example, which is a day treatment program. We have individual outpatient med management as well. And we have a partial hospitalization for kids that runs into the evening so it doesn't interrupt with school.
Sure.
I think the biggest thing for us is always making sure that we find what level of care or what services are going to be needed for them, right? Because it doesn't matter if they come into our hospital or if they come into our services. We're just looking to get them plugged into the best place for them so they can get into the treatment they need to get back on their feet.
Yeah, I like that. And you're also partnering with the American Foundation for Suicide Prevention. Jacqueline, can you share more on your organization?
Yeah, absolutely. So the American Foundation for Suicide Prevention is an organization whose mission is to save lives and bring hope to those affected by suicide. Suicide is the 11th leading cause of death here in the state of Arkansas. It's the 2nd leading cause of death for ages 10 to 35. And so our organization works diligently throughout the state to provide prevention education, support, and then also to raise awareness about suicide and raise funds for research.
Yeah,
Sure.
certainly. Can you dive in a little bit on that more? What are you specifically doing in our region or maybe even across the state?
Absolutely. So we've got a couple events coming up you can participate in. We've got our Theta Chi campus walk that's happening at the University of Arkansas, and you've seen some pictures about that this morning. We also have our Hike for Hope that's happening in May. May is mental health awareness. And then we have our NWA Ride to Fight Suicide, that's in July. So if you're a motorcycle enthusiast, you can help raise funds for suicide prevention and also come enjoy your motorcycles. And then we also have an Out of the Darkness community walk happening in October. But the biggest thing for us is we want to educate people.
Sure.
We want people to know what it looks like when somebody's in crisis, the warning signs, and then the next steps of what to do.
Yeah.
Sure.
And how to get people help.
Sure. Yeah.
We know of the weekend, Rogers High School had
Yes.
a Darkness Walk. So students actually had the chance to participate in that. Can you give us a little bit more information about the Out of Darkness walks that you're hosting?
So these are nationwide walks that happen. We have over 160 campuses that participate in this over our nation. And the idea is to bring the topic and the discussion of suicide out of the darkness. And so this past weekend, we went to Rogers High School, and the students were very, very passionate. We had over 100 people there, and they all walked to raise awareness about this leading cause of death.
Yeah.
Yeah, absolutely. Talk about just for you, what is that like to see students be so involved when it comes to a tough topic like suicide?
It's incredibly encouraging to me as a mom to see these young people that are recognizing that, hey, it's okay to not be okay. What's not okay is to not get the help you need.
Right.
And so it's incredibly encouraging for me and for our organization just to see these students come together and say, this is important, and we really want to make sure that we are aware, that we're educated, and that we're raising awareness about it.
Sure, absolutely, and that's where the partnership comes in with Springwoods
100%.
Behavioral Health. How can people reach out if they're in crisis, Jordan, or if they feel like they know somebody who may be in need of some services?
So the nice thing is we're available 24/7 for a phone call. You can call our facility at any point and get that information. The other thing that I'll say is that anybody can make this type of referral, right? You've got to recognize that it's okay. I go to therapy. People should go to therapy. We should feel comfortable doing so, and you should feel comfortable recommending somebody to get their life saved.
Sure.
If you saw somebody with a broken leg, you would know that they need to go to the emergency room. But somebody with a broken heart or somebody that doesn't feel right, you may not know where to go. And we are that place.
Yeah.
Yes.
That's great. Yeah, thank you both so much for joining us, filling us in, keeping us aware, raising awareness about this, and helping to bring it out of the dark. We really appreciate both of your time.
Thank you so much.
Absolutely. Thank you.
Thank you.
Absolutely.